Welcome to yet another webinar session. And today's session is a very interesting topic. I think you've all heard of this, combating diabetes, reversing diabetes. But, we always had this question in our mind, is it even possible? Is that even possible to reverse diabetes? And today's session is all about understanding how lifestyle modification, lifestyle management can help us get out of this, dreadful disease. There's diabetes that's going to really become. I mean, one thing that is very scary about diabetes is, like, I'm not too sure about other diseases whether it eats about all your cells, all your organs, and gives us so many pathies, is neuropathy, nephropathy, retinopathy, whatever pathies. I don't know that, but diabetes has the capacity to give all of these things to us. And amongst the situation that we are fighting this, COVID situation, we are fighting this, and we're fighting Corona. Some of us still fight diabetes. And we have a group of panelists with us, starting from Dr. Kannan Pugarendi, who's got his 30 years of experience in the field of sports medicine. Sorry for being so fake, he's my husband. I have to say that as well. But again, this is going to be a very formal interview. So I'm going to introduce him as who he is. He's a sports physician. He's been having 30 years of experience in the field, and he believes exercise is medicine. Almost, where I don't know, not many doctors prescribe exercise as one of their prescription. Amongst their medicine prescription, exercise is not even common. But Dr. Kannan has been prescribing exercise as medicine for so many years now. So I'm very proud in introducing him. Thank you very much, Doc.
Thank you.
And we also have Dr. Kartiyayani, who's a developmental pediatrician. She is here with us to share about how yoga and other aspects of yoga, asanas, and those things, how can that help? Because, I mean, if diabetes is also an endocrine disease and things like that, I'm just going to be more curious, and we're all curious about understanding how yoga can help us. So she is a trained yoga teacher from KYM. Welcome, Doc. Welcome, Dr. Kartiyayani.
Thank you so much. Thank you. Thank you.
And we have one amongst us, my colleague. Welcome, Debdatta, or Ria. Her pet name is also Ria. So some of us know her as Ria, and some of us are known to her. We know her as Deb. So welcome, Deb.
Thank you, ma'am.
Thank you very much for joining us. So I'm going to start with Dr. Kannan with the basic rudimentary question that we all have in our mind. What is diabetes, Doc? Because, some people say it's sugar disease. I'm like, what's sugar disease? Only if you eat sugar? Or some of them say it's lifestyle disease where you're sedentary and that's the reason. Some of them say it's obesity disease. And there are type 1, type 2, type 3 probably. I do not know. I'm just kidding. I know there's no type 3. But however, we're all, always wondering, what is this diabetes? Can you explain what is type 2 diabetes and how we are our own, we cause this for us?
Good evening to everybody. Thank you, Sujata. I really appreciate for that introduction, and welcome Dr. Kartiyayani ma'am and Deb. All of them are very good speakers, and I realize that my actual work becomes more and more difficult when I have very good speakers on the panel, because then I realize I'm on a tender hooks to speak the best thing possible and still be relevant. So my whole work here, the first time, I think, when Kartiyayani ma'am will agree with me, some of the senior doctors, when they taught us diabetes, I remember the first time when I was introduced to diabetes by Professor V.T. Balaraman. He would say, polyuria, polyphagia, polydipsia, all the 3 P's. You will have pahum, thirst, intense thirst. And you will eat like gadod gaja, all the food, you eat, and then you pass urine. So this you can never forget, because that was taught to us, the triple P's. So we had to work with this triple P's as polyphagia, polyuria, and polydipsia. Polydipsia is thirst, intense thirst. Polyuria is intense urination, and polyphagia is intense hunger. So these are the 3 symptoms that were taught to us, and always look for them in a patient. And very common for all of us when we are working in the ICCU, that we have diabetic patients in those days being in a diabetic coma, not uncommon. So they have to have a urine test done as well as the blood test done, which used to be very common at that time. So we were in the ICCU in the Government General Hospital, and unfortunately the physician was in charge, starting his morning rounds at before 6 o'clock and hand over to the next guy. He's going through his rounds. So he's asking, okay, doctor, how is this patient? Sir, diabetic coma, we stated. So me and my friend were standing there and he said, what about the urine? Sugar. He said, sir, the biochemist has not come, so we have not. Sir, doctor, if it doesn't come, you have a bedside method. What's the bedside method? Staff. He said, bring the test tube. So they poured the urine from the urinary bag, the collection bag, and put it into the test tube. Hold it there, doctor. So staff held there, and she gave it to me because he's saying hold it. So I was holding it. And then the man put his finger in there and put it into his mouth. He put the finger into that test tube and put it into his mouth. And then he said, don't you know this bedside method? Do it. And thank God it was my friend. I was standing there and looking at him. Okay, that's your opportunity, not mine. Luckily, I'm holding the test tube and not putting it into my mouth. So this guy puts his finger, and as he puts the same finger on the mouth, the doctor said, stupid fool. Did you see which finger I put into the test tube and which finger I put into the mouth? He put his index finger into the test tube and put the middle finger into his mouth. Can't you see this is a power of observation? So when you work with diabetic people, you must have the observation, or any other patient. These are two incidences I'm quoting here. One as a joke. The other is the fact that we have lost the power of observation in most of our clinical practices, depend on biochemical tests. So diabetes is a very, very chronic disease affecting the glucose metabolism. And the same diabetes mellitus. What is mellitus means? Honey-like. What is diabetes? Increased urination. So even in our ancient medicine, Ayurveda, it's called as madhumegam. Madhumegam. So you can understand that the urine color or urine taste was being referred to, increased urination and the taste. So you should understand that this disease seems to take, the people will melt, ilumburukinoi. So it will melt literally. That kind of expression that they used to give us when we were in the medical college. That is the time when diabetes was literally coming out as a major disease to be reckoned, and diabetology was not a specialty in the 1970s, as we were 70s and 80s. We were just getting in there. And at that point, when diabetology department was being established, we realized it's a separate study on its own, because it has become more virulent than what you think this coronavirus is. That's what we want to tell you. When we learn about differential diagnosis, what is differential diagnosis? For any patient we see, is there any other diagnosis for this patient? Two conditions they will tell us that you need to remember, and you'll always say in your exam and in your life. What is it? Diabetes is one, and tuberculosis is another. Because from this end to the other end, it will attack everything. So we realized tuberculosis is gone. Luckily for whatever medicine we have got, we have taken out tuberculosis. But diabetes, incurable disease, progressive in nature, because your insulin secretion is not there, not going to be there for optimal amount, and the glucose to be managed is not possible. So I must understand it's a lifelong dependency on medication. This is one disease. You're going to be dependent on the lifelong on medication. Once you are proclaimed as a diabetic, you can't get out of it. And today we have radical surgeries. Name it, we have a bariatric surgery. You can make sure the stomach can be shrunk in size, and thereby whatever you eat can be so minimized that we can pass through and make sure this gut that is available for you to eat as much as you want is minimized. This is one diet. And the latest one that is available, they call it as medically induced bulimia. What does it mean? As a tube in your stomach that will push out all the things that you ate. So you can eat as much as you want, and still you can be not affected by the disease. Can you imagine any other animal in the whole animal kingdom will eat itself due to food and cause so much of damage? So understand that what we eat is the key. So when we understand the disease now, the whole attitude, thinking has altered. Diabetes, as it is controlled, caused by insulin, a chronic overconsumption of glucose. Chronic overconsumption. If you go to a house, what do we buy? Sweets, sir. If you go to anyone visiting in the hospital, even for them, we'll buy sweets if possible. You have cured, no, you must buy sweets. And then we'll be able to, give this person diabetes as early as possible or sink in diabetes more. So anyone who goes to anybody's house, they'll buy a box of sweets. It's a common practice for us and we should be given up. Unfortunately, how many sweet and savory shops will be affected by this is God only knows, they will be cursing. But fact lies that you should only bless the people whom you meet and don't buy them these kind of sweets. A very important one for us to know. And there is so much of clinical trials today about this diabetes. All of us have already learned about the disease that there is an insulin which is to be secreted and push the glucose from the blood into the cells. Okay, sir, this is too much, sir. What is this insulin? What is this glucose? Madam, this is the school corridor. As the principal walks, all the students will run into the classroom. So principal is like the insulin. Whenever the principal is in the corridor, all the students will be inside the classroom. They will not go outside. Even the teacher will be inside the classroom. Very important requirement. Now, if the teacher is not there, insulin is not there, glucose has the possibility of being walking around in the corridor. Here is a principal walking along and still the students are not afraid of the principal and they're all waiting outside the classroom and ridiculing the principal for, what are you doing here? That is the stage of diabetes, wherein the response of the glucose molecule to go into the classroom is minimized due to one, the student doesn't fear the principal. One concept that we have given, and we believe that is so. So the resistance to the insulin and non-responsiveness to the insulin that is secreted. This is one. The other is there is a lot of glucose already students are inside the class. There's no space for another student to go inside. How can we then ask the principal to push this child in? So the principal also can't help. Child doesn't know where to go. So if there's an inspection at that time, you are doing a blood test. What will we do? We'll shift them all into another class or shift a few of these guys, put into even the kindergarten class, children will sit. So other classrooms, they will sit. So other organs will be taking the extra glucose with the medicines that we give and deposit them in the liver, kidney, spleen, eye, anywhere that is possible with metformin. And that's what we have been doing. We didn't actually clear the problem. We distributed the problem like corona. This is what has happened. So the fact lies that the diabetic treatment has been not effective because the medication that we took, we believed was the best, not that it was an intentionally done one. Please don't misunderstand. It was done because it was the only thing available. Today, if there is an availability, how do we look at it? How does that can be changed? Nearly 75% clinical trials have been done, wherein they have found that these dietary restrictions have worked wonderfully well. And there are more than 330 people on a clinical study, and they found that those who have been on the restricted diet and intermittent fasting, 97% of them have come out of an insulin dependency. And what is an insulin dependent? IDDM, insulin dependent diabetes mellitus. Patients have come out of it 97%. It's a phenomenal number. Then nearly 57% are not anymore called as diabetics. No more diabetic. This is going to be a phenomenal threat to medical professionals because how can a dietary change can bring about an absolute paradigm shift in the treatment of diabetes. In no more a treatment, it is going to be a food that is going to do the trick. And that is what is going to make a change in all of us to believe that this diabetic diet can make this change for us. So most of us have way of hiding the glucose. We want to hide the glucose somewhere. If we can't hide the glucose, then it will affect the disease. It's like somebody This is again a joke, so that we can relax a little bit. Otherwise, with the corona, most of us are in a tensed mode. So I thought I'll have another joke here. Somebody was meeting Queen Elizabeth in her place, and she's an Indian ambassador perhaps, and Queen was talking for some time, and suddenly she smelled there's a bad smell. And so the Scotland Yard was invited. They went around, checked, and they finally zoomed in on the ambassador. So the ambassador said, "Madam, I'm wearing very new clothes. Everything is fine." And then he pulled a shirt, and the bunion inside was very dirty. So he said, "Please take him and give him a new one." So they took him, gave him a new one. They sat down to speak, and they were talking. Suddenly, she felt a smell again. So she zoomed in and asked him. He said, "No, I've got a new t-shirt. Now bunion is new. There's no new vest. No problem." Then when Nandang, he said, "Where is the old one?" "Sir, it is in my pocket." He takes it out of the pocket. So this is hiding. So what we did with diabetic treatment is we hid the glucose in various places, and we never took care of restricting the glucose itself, but we thought it is happening through to something else, and the restriction of glucose at the intense level never happened. In fact, when we put the pyramid, the food pyramid, we should give more amount of carb. And the more amount of carb that we gave, not for athletes, for people who never exercised. And that was given as a dietary guideline from 2006 onwards, the major component, wherein we shifted the whole disease into a different proportion. And that is how all of us have been telling, including myself, for people, because that was the basic base of the pyramid, more amount of carb to be given, not fat. Fat was sitting much higher. Today we realize that fat can come down and this can go up, or non-existent perhaps, minimal possible. And that is what is the whole discussion is about, that you can take fat and still not be affected by it. That was very, very interesting, because all along our medical institution, we thought fat is a bad guy. He's like Kumbhakarna. If you wake him, it's going to be trouble, and he's sleeping is also trouble. So fat is not something you will consume, very minimal. But we have come to the conclusion today that fat is safe, but the carb that is getting converted into fat inside the body, getting deposited into the organ, not on the viscera as fat, not on the skin as fat, but it is deposited inside the organs. That is when it is going to be a detrimental issue. So deposition of this fat inside the liver causes what we call as non-alcoholic steatohepatitis. So we realize there can be a cirrhosis of liver because excess of glucose getting converted into fat in the liver, because it cannot be handled in the other cells, especially more than the muscles and the other cells that can store glucose. They have crossed their threshold and cannot hold more glucose. This is the insulin resistance. So the whole treatment today is how to break that insulin resistance, how to make sure the mouth that brings the food into the body, what is going to be the Annamaya. Madam is going to talk about the Annamaya Kosha. What is this Annamaya Kosha? We have never talked, no, it is not about the sound. It is about what it can convert. Annamaya means it changes. The food that what we ate changed the whole body. It made what we are. It can also, according to the Ayurveda, it says very clearly, the food that you ate only made you grow, and the food only will eat you ultimately. So most important component, if you don't take the food in the right quantity, it can cause death and it can cause diabetes. So the whole discussion here, all of them are going to talk to you about how various components have been given. Perhaps Ayurveda may have another approach, but definitely we'll be able to see that the requirement of the carbohydrate in a refined form, where any packeted food can be detrimental to our health. So a pasta or any kind of bread that you're going to make with white flour is going to be detrimental. And the white rice that we polished and polished and polished and made it more and more attractive and more tasty is the last thing that we can consume today. But we are consuming in large quantities. When we had malnutrition, Dr. Swaminathan gave us the options of having a variety of rice and gave us these new forms of rice. But today, the same thing has led to overconsumption of this particular element, the rice, and that has been a major problem, threat to us in the form of diabetes. So I have various aspects of this, and as we go on discussing, we'll bring everything together. I hope I've given you an introduction that we need glucose in a very minimal quantity, and we need insulin to be secreted in the minimal quantity. If these two are not understood, we are going to be in trouble. Then how will I be satiated? I need a food to be satiating me. I must have the sense of being happy about the food I ate. That's where fat comes into place. Even excess protein, the amino acids can get converted into glucose. And that means they have a capacity to be available more as glucose. So we need to understand the excess protein, the milkshakes that we are talking about, the excess amount of amino acids that you can. It's all not about people who are exercising. It's about people who don't exercise or exercise minimally, or also exercising. These are not competitive athletes we are talking about. I hope this is very clear, because most of the things that I wanted to say, I'm not a dietitian, I am not a diabetologist, but I am giving all this information coming from a sports medicine end, where exercise can do only a certain limited portion of the whole thing. But the fasting, when you are able to avoid taking in food, which is there in all the religions, that fasting is essential to make sure that the whole gut goes into hibernation, and thereby prevent extra amount of material walking in. This was very important for all our religious statements. So I feel whether it's Lent or Ramadan or any form of I think in a Hindu pilgrimage, we always have a dieting. We make sure that our stomach is empty, kept empty. So 24-hour fasting makes the cells more responsive to the minimal insulin secreted, and be responsible to remove the glucose from the circulation, and not allowing it to be in excess is the pride and responsibility of an individual. If you are going to consume more glucose, welcome. We are very happy to see you as a diabetic individual. 75 million people are pre-diabetic today, waiting to jump into the diabetic status. Please, if you are going to have this attitude when you are around 25 to 30, we are seeing younger and younger people converting into pre-diabetic to a diabetic state because of overeating, eating when you are not hungry, eating the wrong food, and the damage is phenomenally high, and you're going to have trouble. So if you want to avoid the damage, you need to consume less. Yaga varayanam nakhaka. So Valluvar says that you need to control your tongue, not only for the words you speak, but also the food that goes into the mouth. So if you can control that, you can avoid diseases. So in my opinion, the whole Kural can have another meaning, that they can have diseases also. I'll now let ma'am take over, Sujata. I think there's time for all the three of us to speak.
Yes, Doc, I'm not finished yet. I have questions.
Oh my goodness. Okay.
You said very clearly that this is a dietary disease. Yeah, basically how our food habits, our food diet discipline, if you don't have that, and then what we consume, maybe carb toxicity or something that that been there for a longer period of time, and our food habits and all that has put us into a situation, and we are in this environment constantly forced to eat something sugary or something starchy, something full of carbohydrate. Now, my question is, does this dietary discipline, whatever, like you said, intermittent fasting, or, we're also going to be talking about LCHF with them. Now, does this really have an influence over this disease? Like you said, this is reversible. Diabetes is reversible. Is obesity a major reason for diabetes? Because there are people who are skinny fat and there are people who are healthy fat. When I say healthy fat, I am a diabetic individual. I have a very strong hereditary, both my parents having diabetes and all that. And I've always seen I'm not as fat as the other person. And how come he is not diabetic and I'm diabetic? I've always wondered why. Now, can you explain why some of them are escaping out of this diabetes and some of them are victims of it? Of course, what you said is definitely making me feel so empowered. I feel I'm in control. When I have a proper diet discipline and exercise routine, I would be able to fight this. But can you explain the skinny fat people and healthy fat people? difference?
No, very interesting. A lot of people ask me these questions. Doctor, when I want to lose fat, I don't want to lose fat in my face. I want to lose only fat in my thigh. There is no way that you can remove fat preferentially from a particular deposit. When they want to come and take the money from you, they won't prefer a deposit. They will take whatever that is available, any thief. Similarly, whenever there is a requirement for the body, it need not look at a particular place. But very interestingly, the appendages where it gets deposited is not an issue. But abdominal fat seems to be different. The visceral fat and the fat within the organs, they are totally different. So removing the fat deposit in the organs are going to be much more difficult. And even though the person may be thin outside, he or she is fat inside. Imagine they are appearing, there's a song, no? Usipela odambu irundha thevai illa pharmacy. Okay? So if you have a body like a needle, you won't require a pharmacy. But unfortunately, these people are there. There are diabetic people who are very thin and have enough fat deposited in the organ and have gone for trouble. So you will think, no, they have melted and that's how it has come. No, there are thin people who are getting diabetes. There are fat people getting diabetes. So it is in the interest of the carbohydrate metabolism that has gone haywire because of the overconsumption of carbohydrate for 10 to 20 years, which can have a genetic predisposition, which can have other issues as stress, which can have other issues of inactivity and exercise being absent. Lot of factors come into play. In my opinion, stress is a very important factor for diabetes. If you don't have stress, sometimes people may escape even with a bad diet because the stress is a very important component. We are failing to look at this as one. And even the word diabetes to somebody who doesn't have it, they are stressed out by, my God, this is for life. So our whole process is we can have a reversal of diabetes is not, it is a process and it is not an event. Please, if you ask me a question, okay, will we reach it tomorrow? No, it is a process and it's dependent on the compliance of the individual who is going to participate in the whole program to know that they are responsible and we are only guiding the whole individual. And if they weep out, we don't even enter to say this medication needn't be taken, be done by the diabetologist. We don't have to enter into it, but we can control the diet and ensure that the individual comes out of the requirement of medication, not done by anyone else but the diabetologists themselves will make a lot of difference. And that's what is more important. So deposit of fat inside the organ is the key element. That's why it's a problematic. So those who get deposited in the central part of the body may have central obesity, which is more difficult to treat than the obesity peripheral.
Okay. And that's childhood obesity causes problem because, some of us yo-yo between having their weights being higher than their BMI and obesity and all that. Then again, it comes down. So it's been a yo-yo throughout the time period of my childhood. So do you think such things could also be a cause for diabetes in future?
Now, when we are talking about children getting obese, most of the time they are overfed. They're saying I'm full. No, mother wants to feed them more. This is one. Mother feels that I must feed my child. Today there is enough food and we feel feeding is very important and part of the mother's conditioned reflex to fill the belly of the child more than the requirement. This is one. The second component is if we have a childhood obesity, possibility of the child having a very inactive life. All of them are sitting in front of the TV, computers, cell phones. They don't have activity at all. The second component. The third component is that these individuals may have a predilection for having more amount of glucose, refined glucose in the form of chocolates, in the form of anything that is available, and we feel this uncle will buy this chocolate for me, I like him very much. And whenever he comes, he buys me a box of chocolates. Remember the film Forrest Gump? My mama used to give me a box of chocolates. The box of chocolates is a very important component. So we all like, whom do we like who gave chocolates to us? But not understanding that those chocolates can be disastrous to my health. So childhood obesity is an issue if these people also already had a genetic predisposition, inactivity, and they also have a stress. Others are, telling that they are obese, mildly obese, and they may say, okay, I lose a point and I'm not bothered. So I want to do it against them because I want to be obese. They overeat also. Possibility of this, those ones can lead to childhood obesity and again to diabetes prematurely. So these people can go in for diabetes, and those women who are going to be involved, who are pregnant, can have diabetics, gestational diabetes as an issue because they were obese during the time when they were from the birth to the menarche. So during that time, any kind of misuse, abuse, overuse to the gut, misuse, abuse, overuse, not disuse, the other thing. So this gut is being overused, misused, abused. Naturally, the possibility of us having a childhood obesity.
Well, I'm going to go and fight with my grandparents. Okay, so, Doc, like you said, there's one thing, stress. It's even a gentleman has asked the same question here. We all know stress unknown etiology. We don't know where it comes from. At least we know, we get coronavirus causes, a particular disease, but we don't know where stress comes from, and the stress threshold for individuals are differing. You may probably be able to handle some stress and I may not be able to, and I may collapse. Now, how do we handle stress? What are the combating measures for stress? Do you have any? I mean, because you're exercise medicine specialist, I think that's you have to answer my question here, because stress is one
I
problem.
think that this is where
In
actually
any disease for that matter, doctors very conveniently put it saying, it's stress. So we don't know where it comes from.
I'm actually entering into the space of Katyayani ma'am and the yoga, and then tell about, we have the Annamaya Kosha. The Annamaya Kosha is the Stula Sarira, the Sukshma Sarira. That Sarira that we cannot see comes under the Pranamaya Kosha, Manomaya Kosha, and Vijnanamaya Kosha. These three are the Sukshma Sarira that we cannot see. So the Manomaya Kosha, where the Manas says, wow, I like this very much. I want this today. Today itself, that box of gulab jamun made, I will finish in one day so that she'll make another jamun or another jalebi tomorrow, because mother will do it because I like it, they like it, to making it for us children. So these kind of control on the Manomaya Kosha, because the Manas wants to do. Manas likes and dislikes are with the Manas. The next comes the Pranamaya Kosha, because the Agni, basically the amount of heat that you can generate with the breath or anything, is going to be minimized because the way that you breathe is also altered. So the breath, if they are going to move in for what we call the altered breathing pattern syndrome, possibility of changes in the whole biochemistry is available. Then the last one as Vijnanamaya Kosha, this is right, this is wrong. Somebody tells you whatever you're doing is wrong. How do we deal with the situation? Because your inside says this is right. So we are in a war with the society, or war with the teacher, or war with somebody. So these kind of things are all possible for us to change our attitude towards the food we eat and its response biochemically. So understand the stress is something that we give ourselves, not somebody. Teedum nandrum pirar taravara. Good and the bad cannot be given by somebody. It is given as a gift by yourself to yourself, by you to yourself. So don't blame anybody else. So the thought, constant thought, chitta vritti nirodha. If you don't have that constant thought of, I must do this, I must do that. Now, at the same time, there are multitasking happening. At least for 15 minutes, there must be some dhyana. So, madam will talk about it. I don't want to talk, but I want to mention from our sports medicine, even the best of the cricket teams are wanting the yoga specialists to give them dhyan. So they have come to that. So you can believe that the world is turning around. I'm looking at an Indian background, people with Indian background having the knowledge of yoga and dhyana to come into the picture. I think ma'am will talk when she comes.
Doc, thanks for definitely. I understand that yoga. Can yoga be done as exercise? Or I know you've already said this a couple of times that yoga may not be exercise and it should not be clubbed with exercise. But what I'm asking here is, does asana and pranayama done at a different time, does it really help solve this problem? Is, like you said, it is reversible. Does it really help on all of these situations that we are in?
Two things. Those who have already gone into yoga have already moved into the what we call as the yama and the niyama, where they are following the abstinences and what they need to make sure that they are prevent those things also to make sure that they don't hurt others. There is what we call as ahimsa. You don't hurt somebody. Satya. You don't tell lies. You tell only the truth. Like this, so many components which makes you control your environment, your society, and you are so strong that you are not identified yourself as I is what yoga talks about. So the dhyan helps you to move into the higher realms, which is not possible otherwise when you are stuck with the day-to-day activities and believe that your responsibility is so high. Who controls corona today? Let us worry. Every time we are looking at the paper, we feel somebody has got more corona. Can you and I control corona? No. You'd rather leave it, let the divinity do that. As doctors, we have to do our job, but the divinity does its own work, and that is going to happen whether we do it or not. So the worry about the fear, the emotions, anger, anxiety, adoration, grief, fear, joy, hatred, these 7 emotions are very important for us to avoid being in stress. Please, I think ma'am will.
Yeah, yes, Doc. Dr. Katyan is going to explain the 8 limbs of yoga. My question was only asana and pranayama. Can we only take that if, that can be done as part of exercise? And do you think that will have an influence? So that is what
Yes, it will. It will. There's
yeah.
no doubt. Because the only form in the whole world which has worked with the organ specifically, there's only yoga. There is no other system in the world which can compare with the capacity of yoga. I will bow down to the capacity that available in yoga. There's no question about it. The rishis have worked on every posture with the chakras in mind, which our science doesn't have a clue.
Doc, you also explained, you've also spoken in a lot of schools about how playtime can be, or the PT periods, the physical education staffs can be given a lot of work where they can really help the children, fight all of these things at a very young age and not go through the obesity phase and become a diabetic in future and all that. So you've always explained these things. Now, for childhood, like obesity, like I said, the yo-yo situation. Is there any study that says that over a period of time that you have been fat, like, my BMI was high, and there you also said that after a couple of years or a mid-30s or something, they would become diabetic. Is that proven?
No, as we have already said, if they had a child with obesity, the possibility of shifting from a non-diabetic state into a diabetic state is a high probability. It is not a proven state, because how this individual environment alters in terms of the stress they receive, the food they take, the inactivity they go through can change a lot of things that can happen. So I want to make sure that all of them who are listening to how much stress people go through. When I said physical education, they must look at not competitive sport. They must look at general fitness. Competitive sport is only for the very few children, 5 to 10% of the whole school population. Unfortunately, physical education is looking towards a wrong wall and trying to get the maximum children into it, only 5 to 10%, whereas the teacher is responsible for the whole school, from the kindergarten up to all the other classes, 12th standard. But unfortunately, during exams, they shut down and there's so much of limitations. If you send your child to school, you ask them whether you studied. You ask the child, did you play today? Did you enjoy your game today? No child tells you that. That means they are stressed.
Okay.
And they'll be obese.
Yeah. Last question to you. I just want to know, during this lockdown time, we've been sedentary. I know sitting is the new smoking. We've always spoken about that. We've been sedentary, but now currently in the lockdown situation, we are more sedentary. Can you give us some simple tips throughout the day that I can be active and I can be, reducing my blood glucose level? You've already spoken about diet aspects, but can you give me some examples of exercise, like every 1 hour you should do this, or every half an hour you should do this? Because half an hour of workout is not enough throughout the day, and being sitting down in one place, half an hour of exercise is not going to give us the benefit of exercise. We all know that. Can you suggest something on that?
Please, other than this listening to me, don't sit in your seat. If you can move, our whole idea, the logo reads, move to heal. We heal people only in movement. So we need to ensure that we need to move. In that movement can be that you can go up and down the steps 10 times in the morning, 10 times in the evening, 10 times, whenever you have had a 2-hour gap between your food, your meal has taken 2 hours of gap, you can go ahead to do that. You can even walk the terrace. You can walk the road with a mask on if it is possible. They have not told you not to go out. You can go out, but you are not going to be exposed to the other individual and maintain social distancing. That doesn't mean you should distance your own body from what it needs. It is you all eat food, no. In all these 2 months of lockdown, did we stop eating? That alone went like gaba, gaba, gadab, gaja, we ate. So naturally, we'll feel the consequences of this also. We should make sure that we do not eat so much. And if you can, in yoga, there is some statement, those who eat 3 times a day, they are rogis. Those who eat 2 times a day, they are bogis. Those who eat once a day, they are yogis. The yogi didn't eat so much because they ate the food less and made sure that the consumption of input, the input is less, the output is reduced to the bare minimum. Unnecessary talking is not there. I think I should have given a lot more.
Thanks. Hope we travel from Rogi to Yogi in this lockdown time period and help, get out of this diabetes mode. Thanks.
No. All of us will be preferring the Rogi state because it doesn't happen tomorrow. So it takes a long time.
That's right. True. Behavioral modification. Yes, I agree.
Great.
Thank you very much for sharing all of these information with us. And over to Dr. Kartiyayani. Dr. Kartiyayani is a developmental pediatrician, doc. And we've been very fascinated about your, whenever you share your yoga experiences with us. Could you, we've all, there was an introduction, Dr. Kannan said, yoga definitely helps in handling diabetes, mellitus and things like that. Can you tell me a little more about that?
Thank you, Mrs. Sujata, for first having me over for the session. I think Dr. Kannan has so beautifully said, and it's given most of it already, what a person can pursue through yoga. Coming to say that what yoga can do, what yoga cannot do is what my question would be. So yoga, as what we say, is not just the physical asana and pranayama. It has 8 limbs. We call it as Ashtanga yoga. So there is a disciplinary preludes already to the Ashtanga, one of the two Ashtangas, that is your Yama and Niyama. What we talk about the dietary disciplines and the physical activity, all these are already there in Yama and Niyama. For example, I started yoga when I started a few years before. It was for my physical discipline, to have a routine in the physical. But what it does to the physical, it doesn't stop with the physical. It starts pervading down your line, and then you're craving for food, unnecessarily taking in food. Like 3 o'clock hunger, not necessarily a samosa should go in. You can see what should go in and what, so the awareness comes in. That's the first step. So it pervades the layers. Like Dr. Kannan said about the Annamaya Kosha, Pranamaya Kosha, Vijnanamaya Kosha, Manomaya and Vijnanamaya. There are 4 layers of each of us we carry along with us. These sheets are interconnected. It is not like a closed sheet. It happens in one sheet and it doesn't come into the other. They are interconnected. That's why it's called kosha. So when it happens, this yoga pervades to different layers. It automatically takes it to the root cause of the disease, any illness. And considering diabetes as a lifestyle illness, what we see of recent is quite a lot of talking about diabetes. It's one of the most important illness, which is due to the lifestyle modification. So yoga addresses a lot through all the Ashtanga, that is asana, through the physical asanas. All the asanas are primarily around the axis. They keep the spine as the main referral column, and then the posture changes, either a forward bend or a backward, back arch or a twist, and all these things considering to the spinal axis. And if you see, interestingly, all the endocrine organs are aligned along the spinal axis. If you see the physical aspect, what they call it as in a very subtle way are the energy centers, but what we see physically is endocrines aligned along the spinal axis. So it has an impact on the physical level through asanas. As pranamaya, already he said, prana is one of the very important energy channel which moves within our body. Breath is one of the prana. So by regulating the breath, we can bring about changes in the physiological level and also the psychological level, which is obvious, and I'm sure everybody will agree with me. So breath is one of the important component to anchor the mind. So we addressing the next layer, manomaya, also by which going into by practicing pranayama. Next is the pratyahara. Pratyahara is indrawing your senses from the outside world and bringing it inside. So thereby you have all the focus to yourself and to understand what's happening. So all this comes automatically. You start asana, you next level, it comes automatically. So asana and pranama is what generally been told as yoga, but it pervades into the layers of pratyahara, dharana, dhyana, samadhi. That is your meditation. Till there, you're very focused in what you do. So it goes into the different layers of your koshas and addresses the different layers. So I would say yoga, to take it in a scientific level, as Dr. Kannan says, it's a psycho, neuro, endocrino, immunology.
Wow.
All along the path it acts and it regulates the system, thereby you don't secrete excess cortisol to bring in more glucose to add on to the problem already existing. And also the tissues responds definitely better by not showing any resistance to insulin by practicing yoga.
Wow, Doc, that was awesome. Like, I could understand completely on what the whole thing is. Now, is there any specific asana that we need to be doing, Doc? Do you really suggest anything that this asana would work specifically for diabetes?
There are many schools of thoughts. They say that are prescriptive, but one thing I would always insist: yoga is not a prescriptive. You cannot prescribe as this person can do this asana and they will get rid of the problem. It can never be like that. As we say, individual constitution varies. In Ayurveda, they call it as the doshas, tridosha tattvam. That is what we inherit from a parent. That is a prakriti, which is could be whatever. I could be having vata or I could be having kapha or pitta. This proportion varies. There's a permutation combination of this tridoshas. With my constitution changes how I react to circumstances. This is again the stress what we discussed today. How I face the stress. Stress is everywhere. It could be from morning paper wala doesn't turn up, could be a stress, to I didn't get a job, that could be a stress, or losing a loved one. The varied amount of stress. But how I react to the stress depends upon what temperament comes out of this tridoshas. So what we say is understand the individual constitution and accordingly you can prescribe the first practices and see how they move. If they're moving the way you want, or there's going to be something different you need to prescribe. So we keep moving as a journey along with the person, particularly when you address certain illnesses. So I would say that it is most individualistic. You cannot prescribe as a specific asana for diabetes. Though they say twists will bring out pancreatic compression, all are right. But again, why still somebody not having got over the problem with the physical asanas and pranayama? There's something more to address to it. Same, like you have to see the complete holistic way of looking at it.
Okay, that's really nice, Doc. Now, we were also discussing about this Barker hypothesis. If I
Yeah,
remind you on what is that? I'll be really happy if you can share that with every one of us, because it was quite interesting to understand, and I'm quite curious about it as well.
it's very interesting to see how type 2 diabetes we see these days in very young people. Normally, those days, what we've learned is when our parents get old, then sugar problem is a problem. Nowadays, we find people much younger getting into the grips of diabetes, type 2 diabetes. One, of course, sedentary life, as Dr. Kannan says, we are not working out the way we were earlier working out. But this person, David Barker, who came up with the hypothesis saying that the intrauterine growth retardation, babies who are born with the IUGR, babies who are born premature or underweight, low birth weight, they are the one, when they did a study, longitudinal study to follow up these babies, in a later part, they were having this type 2 diabetes, metabolic syndrome, coronary artery disease much later. And what was the thing I ultimately came out from this was when the child was in the mother's womb, where they are supplemented to the very low nutritional needs. Could be intentional, or it could be the famine struck, could be any reason. So if the child is constantly exposed to a low nutritional need, the genetic makeup, it signals, there is a signaling starts inside to say that switch on the conservation mode, right? Whatever comes, you try and conserve because you don't know the next meal is going to come. So this is the genes which are waking up in the child. So this child been growing into the mother's uterus with a low or a nutritional intake when exposed to an environment where there is plenty available. But the metabolic constitution doesn't change and the genetic switching on, switching off doesn't happen. They continue to, because the persisting through the life. So they have this attitude, I mean, the channel goes on for life. So they are the one who prone for all the adult diseases, what we see as a communicable diseases. So they call it as fetal onset adulthood diseases. And this goes way back through 1918 pandemic flu, when the first flu pandemic hit. There was a post study, they did the trace this after Barker's thing, they went back to see all the things. Yes, there was outcome like this. People who was surviving through very minimal amount of nutrition, they were coming out as a later adult with so many other problems. Particularly the diabetes is one of the things which it was said.
Thanks, Doc. That was very informative. And I could also understand one more thing about myself, that I was a low birth weight child when I was born. And Doc said, keep, your parents and your grandparents kept feeding you, and the conservation mode is probably on still. So thank you very much for that explanation. And that explains that, that I can fight diabetes with what you've spoken so long, like the dietary modification, yoga and exercise and all that. Thank you very much for joining us, Doc.
Thank you.
So over to Debdatta. Deb, I think it's time to explain what we do in Spark and what is this diabetes management program, how we monitor. Can you go ahead and explain the process? Like, I come into the center and I have really handled myself quite well in the last 2 years' time, and I brought my sugar levels down, and I'm not on medication or anything. There are a lot of people who are still having questions, like how does intermittent fasting work? I'm asked to eat 6 meals a day, every 2 hours, something. How does this actually intermittent fasting work, or is there even a process there in the dietary discipline that Spark gives? Can you explain a little more and make us comfortable about what we do in Spark?
Sure, ma'am. First of all, thank you so much for having me. I'm with these esteemed doctors. Talking about this topic is a dream come true. So coming to the topic, so lifestyle management. Why we talk not just about a medicine, a metformin, an insulin to control diabetes, because diabetes is so much more than that. I mean, when you are talking about management of diabetes, you have to fundamentally include what is the support, what is the care that the patient is getting, what is the nutrition therapy being given, what is the exercise prescription being given, what is the physical exercise or physical activity level of the person, what is the stress level of the person. So when we are going forward with treatment of diabetes or a reversal of diabetes, we can't just focus on one point. We have to focus on all of them. So here at Spark, diet and nutrition go hand in hand. So what we do is, first, we have to start off with a comprehensive evaluation. So that means your biochemical tests. So you need to check your blood glucose, fasting, postprandial, HbA1c level, even other levels like your uric acid, thyroid levels, all of that can be checked and should be checked before starting with any kind of treatment, because they always say, like, check with the doctor. So check with your biochemical tests. And this also helps us understand whether what kind of diet will work for you, diet A, diet B, very low carb, slightly low carb, what kind of exercises will work for you. So this helps us understand what are the contraindications and where to start from. Also, we will have a baseline level. We'll have a baseline value, because every treatment, we will only be able to see the efficacy of the treatment when we keep on checking the values day in and day out. So for the follow-up, we should know the baseline values. So a biochemical test has to be done for all. Along with that, we need to go forward with checking your musculoskeletal assessment, fitness assessment, as well as going forward with a lifestyle questionnaire. So lifestyle questionnaire helps us know basically about your diet and your lifestyle, especially your physical activity, as well as certain things that need to be, like personal habits that need to be modified. So we will be filling the lifestyle questionnaire, the musculoskeletal assessment and fitness assessment. Now, why do we need a musculoskeletal assessment and fitness assessment, you will ask? So, a musculoskeletal assessment basically checks all the muscular and the skeletal system of the body. So that includes your anthropometric measurements like your height, your weight, your BMI, waist hip ratio. Waist hip ratio is actually it shows that a person is more predominantly going into diabetes more than the BMI, in fact. So waist hip ratio, especially the waist circumference. So there is a direct correlation between you having diabetes and a high waist circumference. In fact, they say that if your height, for example, if your height is about 70, 80 inches and your waist circumference is more than half of your height, then you are at a very high chance of developing diabetes. So it's very important to measure all of the anthropometric measurements like this. Along with this, we will be checking posture, strength, flexibility, endurance, balance, your neurological systems, everything to be checked in the musculoskeletal assessment. And then your fitness assessment, because for every exercise prescription, of course, we should be checking your cardiovascular fitness, your powerful, muscle power, muscle strength, all of that should be checked in advance so that we can understand what kind of exercises, what kind of diet will work for you, as well as we can keep on progressively changing that. So then first we will be going forward with our diet program. So diet, the diabetic diet that has been widely used, and how Doc beautifully put it up, it was the low carb, high fat diet, which has actually shown 97% of people improving just with the diabetic diet or a low carb, high fat diet. Now, people usually get very scared that, oh my God, this is a diet fad. And how am I supposed to follow this? I've always eaten rice. So I wanted to discuss about a small topic called carb toxicity, where we started having carbs only very recently. Initially, we were hunter-gatherers. So our carb consumption was only 15%, 1.5. And now it has gone up to 60%. So when we shifted to agriculture, we started having rice, roti, all of that. Our carb consumption went up. Then we had refined sugars coming in, cane sugar, and then processed food. So all of this has shot up our carbohydrate consumption to a much higher than a normal level. So how do we control this? I mean, we are still being given a diet to reduce sugar with sugar. And then when your sugar drops too much, they say that, okay, have little sugar throughout the day, and that will help you control your sugar. If you really think of that line in your mind, it will not make sense, because the most fundamental thing will be reducing sugar, right? But if you reduce sugar, your blood sugar will fall. So how do you manage that? So there have been two diets that had come up. The previously most common diet was the Atkins diet that increased the protein a lot. But then we found out that, in our body has a system of burning the nutrition that we are getting. So first it will burn carb, then it will burn protein, then it will burn fat. So that is why in the low carb diet, we have less protein as well as less carbs and only high fat. Okay. Because if we have a very high protein, you will start to burn your muscle mass also. So that is why the fat content is high. Now, people are scared that, oh my God, how do I eat fat? Because 30 years, the doctors have all told us that fat causes fat. But then we all know now that with all of the new research is coming up, that fat doesn't cause fat. Actually, carbohydrates cause fat. Because as Doctor beautifully put this, that carbohydrates or the excess carbohydrate stores that we don't use, it goes into a reserve. So everything is being stored into the organs. Now, why are we taking so much of excess? When are we going to start using our reserves? That is where the low carb, high fat diet comes in. So you basically maintain a high fat and you're tricking your body into thinking that you are into a starvation mode. So everything that is reserved, that starts to be utilized. That is how you reverse diabetes. I mean, whatever is already present in the body, that starts to be utilized. So you have a steady flow or a throughout a day flow of energy because you already have the energy inside you. You already have the fat stored. So your body starts to burn the fat within the body to be able to produce energy. So that is how, that is the principle that the low carb, high fat diet works on. And when we talk about low carb, we are not talking very low carb, which people will again be very scared about. The low carb will be around 100 grams, 100 to 130 grams is still considered low carb.
Okay.
And we slowly, steadily get the client into this particular diet. Like we first start with replacing all the carb sources with more nutrient-rich sources, which will be quite comfortable. Like you in the morning for your breakfast, replace your toast with boiled eggs. So that is also equally healthy, and that is much higher in fat, doesn't have sugar at all. And when you're in this diet, slowly you will feel that fat is keeping you full.
That's
So
right.
we had a lot of questions where people said that my blood sugar will drop, or if the hunger comes, I will again go forward with snacking. That is the area where fat really works, because fat will keep you full. So you can shift to intermittent fasting much easily than going forward with intermittent fasting with a carb-rich diet. Because in carb-rich diet, you're constantly reaching out for more carbs.
Correct. And the
So
question seems to be like, what happens when the glucose level, blood glucose level drops? Which again, there's a diabetologist who's involved here, isn't it? We would have to rope in the diabetologist to prescribe the right kind of medication when the glucose levels go down, which means we always monitor blood glucose level, and depending on the blood glucose level, the medication is given. So if you have to alter the medication, we have to also, like if glucose levels are going down, then you have to alter the medication as well. So the diabetologist is going to be involved in the entire process. Am I right?
yes, definitely. Because as it's not just the diabetologist, not just the nutritionist, not just the doctor, even the person providing care for the patient or the client at home is required. So we will definitely not just be checking all the parameters, but we will be checking them as a follow-up, subsequent follow-ups, where we keep checking the HbA1c, the blood glucose, and what is the blood glucose level on that particular day. So daily checking is even better. Weekly checking of the anthropometric measurements as well as these values will be even better. And the diabetologist has to be kept in loop, because we are working with pre-diabetic as well as diabetes type 2 patients mostly. So the blood sugar might start dropping quite early, and then your medication needs to be controlled along with that. So I would definitely feel that keeping the diabetologist in loop, abreast with your condition, with your blood glucose level right now, is very, very important, because they will be guiding your medication. They will be guiding your treatment further. And slowly, see, it's not that one day you can reverse, it's not magic. So
Right.
we all have to work together as a team, the nutritionist, the exercise prescriptionist, the diabetologist, so that we can all slowly reduce the dosage and slowly wean off the dosage for the diabetic medication.
So there is going to be a diet log and an activity log and blood sugar log as well. We're going to monitor that for every other day or every day.
Yes, definitely. See, any
When you're coming
program or
into
any
the
plan, yeah, any plan starts to work only if you are adhering to that plan. So to ensure adherence to that plan, we have to maintain a diet log, we have to maintain an activity log, and we have to make sure, for example, you went out and you went for a wedding and you cheated, you ended up a lot of biryani and you went off the diet, didn't exercise. See, that and all is going to affect your plan, your program, your ability to be able to bounce back from it. So we definitely need to maintain a log along with checking our parameters on a regular basis, so that we are able to understand, and we are also able to give you tips. See, diet, what we are taking care of will be a very short period of time, but what they do at home, we will have to give them the required guidance, the advice, what they can do at home, what they can do outside. So that is how they can stick to their log. So maintaining a log, sticking to the log, is definitely both of our work, ours as well as the patients.
Thank you very much for sharing all of this information with us, Deb. I hope this information, the information that was shared by Dr. Kannan, Dr. Karti, and yourself, that could benefit a lot of people, and we can avoid somehow India being the diabetic capital in 2020. I'm sure of
Yes.
that. Thank you so much. And looking
Thank you,
forward
ma'am.
to yet another webinar session. We'll catch up again. And people who are interested in logging on to what we do as webinar sessions, connect to our YouTube channels. Give us subscribe our YouTube channels as well, because this is live on YouTube as well. Thank you so much.
Thank you.
Thank you, ma'am.
Bye bye.
Thank you.
Thank you. Have a nice day. Thank you. Thank you, ma'am. That is fantastic. Thank you. Thank you to all of you.